Other than skin cancer, breast cancer is the most common cancer among American women, and testing can literally save your life. When it comes to an annual mammogram, accuracy and peace of mind are key. Mammograms are the first line of defense to detect breast cancer early. Our Intisar Faulkner joining us tonight to explain more.
That's right, and just like most cancers, early detection is key. Mammograms can detect cancer before it is big enough to feel or even cause any symptoms. And I'm so happy to be joined by Dr. Myron Barwick with Lexington Medical Center to discuss just how vital these screenings are. Doctor, thank you so much for chatting with me.
Thank you for having me. It's a pleasure to be here.
So first and foremost, doctor, just share with us, what are some symptoms of breast cancer?
Well, a lot of times breast cancers are not even symptomatic at all, and patients don't know that they have them, and they're found on screening mammograms, which is usually the best way to find these. But patients can have a mass in the breast or a lump. They can have a change in the breast size or distortion of the skin. They can have redness of the skin or even a nipple discharge. But we like to find breast cancers on screening mammograms most commonly, but those are some of the symptoms we see.
And when we're talking about the risk factors of breast cancer, talk about that.
Breast cancer is multifactorial. There are a lot of different risk factors, and you don't have to have any of the risk factors to necessarily have a breast cancer. But the most common risk factors are being a female and also aging. And as you get older and as being a female, it's more common to see breast cancers in those patients. Other risk factors can be familial or genetic. Genetic risk factors only account for about 10% of all breast cancers. So 90% of the breast cancers are not related to any genetic predisposition at all. Having a period before the age of 12 or having a menopause after the age of 55 are also risk factors.
Talking about lowering your risk for breast cancer, Dr. Barwick, are there things that women can do?
Yes, there are. One of the things that is important is staying active, and part of that, as you get older, you tend to not be as active. It can increase weight gain. It's been shown that postmenopausal women that do gain weight do have slight increase in breast cancer risk. Decreasing alcohol intake is a good way to reduce your risk also.
And lastly, doctor, talking about mammograms, what do you think is the best time to do so, or when should you just start having that conversation with your doctor?
Well, there are a lot of conflicting organizations out there as to the date of starting your mammogram, but generally most of the recommendations are to start around the age of 40 to 45. And it's something that you should talk with your doctor about, because each person may have a different risk factor, and that may start your mammograms a little bit earlier depending on your familial history. Breast cancer is something that no woman wants to have that diagnosis. It's a difficult diagnosis, that it's one of the largest stressors that people are going to have during their lifetime. And so when you have a breast cancer, if we can deal with it when it's in the early stages, we have a very good chance of curing that and not having that affect your longevity at all. And so early detection is key.
Dr. Barwick, thank you so much for this information, and we'll have all of this listed on our website as well with this story at wistv.com/healthu.